Some fellows requested more talk about the research hypothesis. Therefore, in this video, I'm going to concentrate on these four questions. Whenever we formulate or see a title, question of a research or a hypothesis, then we have to ask these four questions. Does that title or question or a hypothesis provide focus? Does it enable testing? Does it guide methodology? And does it facilitate interpretation? And let us take examples. And let us suppose the research title says comparison of chlorhexidine and povidone iodine in preoperative skin preparation on the rate of surgical site infection amid Sudan war, a prospective descriptive study. Now, this title focused? Yes, it is focused. It is focused on two groups of patients. And does it facilitate a methodology? It is already written here. It is a prospective and descriptive study of two groups using different agents for skin disinfection. And it is concise, it is short, and it helps in designing a research question and a research hypothesis and methodology and interpretation of the results. Now let us see the research question. The research question may say that, is there any difference in the rate of surgical site infection when skin is prepared with povidone iodine versus chlorhexidine amid Sudan war? Again, is this concise? Is it focused? Yes, it is focused and it is concise. And it facilitates formation of two groups, one for preoperative preparation with skin preparation with povidone iodine and the other with preoperative preparation of the skin with chlorhexidine. And we collect the data and it facilitates the analysis and interpretation of the results as well. Now the hypothesis. The hypothesis might say there is no statistical difference in the rate of surgical site infection in preparation of the skin with chlorhexidine and povidone iodine. This is in keeping with the null hypothesis because it says that there is no difference. There is no statistical difference. It goes with the null hypothesis. And usually researchers would like to negate, would like to refute the null hypothesis that says there is no difference between the two groups. And I will speak about this null hypothesis in coming to slides. And let us see another hypothesis which shows the alternative hypothesis, not the null hypothesis, but it is alternative hypothesis, particularly when it is directional, when it tells us the direction of the outcomes. And the hypothesis might say that preoperative skin preparation with povidone iodine leads to a lower surgical site infection than chlorhexidine. So now there is a difference, and we know the direction of the difference. Both hypotheses are concise and focused, and both of them facilitate formation of two groups for comparison, and they can help in a formulation of a methodology and interpretation of the results. However, if we say, if you go with the first hypothesis that there is no difference between the two groups, that is in keeping with the null hypothesis, probably there is a bias, because the study is being done, as in the title, amid war in Sudan. Probably not all cases were collected, and probably some cases they come late with already florid infection. And another third possibility is that probably the sample size is too small to give us a statistical significance. But in the second directional hypothesis, there is definite, it hypothesize, it postulates that there is definite significant statistical difference between the two groups. Group A with povidone iodine disinfection of the skin, and group B with chlorhexidine preparation of the skin before surgery. However, even if it is statistically significant, we should know that there is a small difference between theoretically statistically significant issue and practically significant. For example, let us say with povidone iodine the infection rate was 8%, and with chlorhexidine the infection rate was 10%. So the difference is 2%. Amid war in Sudan, you see the consensus, the concept, it is in the amid war in Sudan. Does that deserve mobilizing the resources to obliterate these 2%, or to accept these 2%? Probably it is very difficult to move during war to locate resources and to mobilize resources, and for this reason we can accept the 2%, which will become practically not significant, although theoretically it is statistical significant. So always in research one should think about practicality of the significance. Now let us look at this example. Also in wartime challenges are associated with a significant increase in the rate of surgical site infection compared to the peacetime baseline rate measured over 6 months. Now, if we ask our questions, it is concise, it is focused, and it tells us two groups. One, which is being done during war in Sudan, and because of the challenges of the war in Sudan, compared to a retrospective study which will be done by analysis of the files of the patient from the medical records, and taking a specific period of 6 months. This means that this is concise, it is specific, it tells about two groups, it helps us in the methodology, and it helps us in analysis and interpretation of the analysis. Furthermore, it is smart because it is specific, it is measurable, it is attainable, can be done, it is relevant to our practice, and has time limit, which is 6 months. So this is a good title. And as I said, it is focused, and it is directional as well. The direction, it increases the wartime challenges, increases the rate of surgical site infections. So it is one-tailed in statistics, and the last videos I will speak about, in the last few coming videos I will speak about some statistics, and I will show about one-tailed and two-tailed statistics. However, here I will just touch on it, and this is directional. Going to one side, it is one-tailed. It is measurable, and as I said, it is smart. The null hypothesis, which is usually written as H0, it reflects no significant statistical relationship between the cause and the effect, between the independent variables and the dependent variables. No association, no correlation, but and this is an example. There is no statistical significant difference in the rate of surgical site infection in preoperative skin preparation with chlorhexidine and povidone iodine, and I have talked about this before. It goes in keeping with the null hypothesis. But the alternative hypothesis, I repeat again, that there is a significant statistical difference or relationship, and in one direction when it is directional. For example, when we say preoperative skin preparation with povidone iodine leads to lower surgical site infection rate than chlorhexidine amid war in Sudan. Of course, adding amid war in Sudan and adding the challenges, the variables that reflect the challenges of the war in Sudan, and when we analyze these challenges also as well, it will give us a novelty, originality of our research. Now look at this graph. This is a normal distribution of the data, and with some concentration here in one tail. There is some concentration in one tail, and this is what I was speaking about, and the significance here, it is 0.05%. People speak about p-value 0.5% here. When it occurs in the two tails, right and left, then it will be half and half, 0.025 and 0.025, and I will speak about this later on. And the space in between them will be the 95% confidence limit. I will speak about statistics in another video. Let us continue with the hypothesis. For example, preoperative biliary drainage influences outcomes of surgery for obstructive jaundice. And this is a concise hypothesis. But it doesn't tell us the direction. It seems to be two-tailed. The direction could be in one side or the other side. It could be it improves or it doesn't improve the surgical outcomes of surgery for obstructive jaundice. If you have a group of obstructive jaundice and you divide them into two, one group will go directly for the definitive surgery and the other group will go for ERCP, removal of CBD stone or insertion of a stent to drain the bile. Which one will have a better outcome? In this study, we do it and then we see whether there is a delay because of the ERCP and stent and retrieval of stone, and probably pancreatitis occurs, or otherwise it could be better. Even with the delay, the outcome will be better, and going directly for definitive surgery might carry an infection rate and bleeding and probably biliary injury, bile duct injuries. So in this way, the hypothesis is bidirectional or non-directional because it goes in both directions. It is focused, of course, into the question, and it suggests possible cause, which is a relief of the jaundice itself, or predisposing factors, and these are the independent variables, and the influence on the dependent variable, which is obstructive jaundice. But it is non-directional, as I said. And when we look here, we see that the biliary drainage is independent variable and the dependent variable is obstructive jaundice. But it formulates also a smart statement for a relationship between the effect and the outcome, particularly if we add time for the hypothesis over 1 year or a study over 2-year analysis, something like this. For example, when we say smart, it is laparoscopic cholecystectomy for acute calculus cholecystitis in elderly patients is safer than open cholecystectomy during wartime. When we say like this, when we say it is safer, it is directional. In wartime, a specific period of war, it makes a period time and a concept as well, and it becomes smart. And now, look at this example. Prevalence and risk factors of diabetic septic foot or diabetic septic ulcer amid Sudan war. Descriptive study of outcomes. Prevalence of and risk factors, two things, prevalence and risk factors. The research question for this title could be, does prevalence of diabetic foot ulcer amid Sudan war increases more than in peacetime? This is a question. We would like to see the number of patients we are seeing during wartime and to compare it with similar period during peacetime and see whether there is increased rate of diabetic foot ulcers. And the hypothesis, it helps us to develop a methodology and to increase the number of variables for the statistical analysis. So the hypothesis could be a scarcity of healthcare centers. We know some healthcare centers were closed and some were ruined. And a scarcity of healthcare providers, and some of them were displaced. And a high frequency of war injuries and high frequency of infection and scarcity of drugs and antibiotics during war and poor glycemic control because of lack of healthcare facilities and poor nutrition because people, they depend on food from Tekaya. They depend on very poor nutritional food. All these 7 factors lead to a higher prevalence of diabetic septic foot than in peacetime. This is a hypothesis. Then the study has to prove it or not, and we have to find out which one of them is the predictor of severity for the diabetic septic foot. A secondary question for the same title could be, what are the factors contributing to glycemic control and advanced Wegener's or Wagner's, it is Wagner's grade in, like Widal test, it is Wagner's, it seems to be a German name, Wagner's grade in diabetic septic foot patients during wartime. What are the factors contributing to 1. Glycemic control and advanced Wagner's grade during wartime? And here we can develop a hypothesis saying that food scarcity, medications unavailability, walking and traveling for several hours and long distances, probably on foot, are independently associated with poor glycemic control and poor Wagner grade. A secondary question: what is the relationship between feeding and grade of diabetic septic foot? Also from this we can break down feeding into several variables, measuring the body weight, the body mass index, measuring the arm circumference, measuring the total protein and albumin, and these things. And here the hypothesis could be non-compliance into diabetic diet. We know people are eating very poor diet. Non-compliance to diabetic diet during wartime is positively correlated to or with the severity of Wagner's grade of diabetic septic ulcers as hypothesis. And this is again directional, it is focused, it helps measurement and it helps interpretation of data. Up to this point, I will stop and I will see you later in the coming sessions on types of research. And after that, we are going to speak about some statistics.